Welcome back to Career Hunters. I'm here at Riverside. My training begins as a home healthcare nurse, and I've got Christina, who works here at Riverside, to help me along.
Yeah.
How long have you been here at Riverside, Christina?
I've been here about 8 years.
8 years, all right. And so what is the first thing as a home health nurse do I need to know?
Well, part of our job is to help people manage their, illnesses or disease process, wounds, all that type of stuff from the hospital. So they don't really need to be in the hospital anymore. Now we take care of them at home.
Gotcha. So here at Riverside, your first thing is you come and do what?
Well, in the morning, I come in and I look at my schedule, and my schedule will tell me all about the patients that I'm seeing that day and what we need to do. So, I go and gather supplies for them and then make my way off to head to their house.
Gotcha. And every patient's different. You ever look at that list and go, oh my goodness, how do I get this all done today?
Every day.
Every day. So you like working at Riverside, obviously. You've been here for a very long time.
Yeah.
So you've got everything packed up, and then you go to the patient's house, correct?
Mm-hmm. Yeah, we go to the patient's house, and like I said, some of them have different things that they need done. We might be doing wound care at the first house and hooking up an IV at the second house. And then, sometimes we have to get labs, and we might take it back to the hospital after we're done, maybe call some doctors and stuff.
Who would make a good candidate for this position? What are some of the things you need to have as a person?
I think that people who enjoy the change of environment every day, rather than going and doing the same thing, having the same routine over and over and over. Instead, I have a different things to look at, different houses to go to every day, different scenarios, different situations.
And Christina, what do you find most rewarding about your job here at Riverside?
The most rewarding part, I think, is watching people be able to take care of themselves and understand their illness, heal their wounds and their infections. Yeah.
That is fantastic. Now, I know you don't show up at the house empty-handed.
Right.
So
yes.
what?
So we have to get our bag together. So if you want to come with me, I'll show you how to get the bag together.
Let's do it.
Okay, so we have a lot of stuff here that we can choose from. We have a couple things that we have to do today. We have some wound care and some trach care, and so I'm just gonna quickly grab some supplies that I just don't happen to have in my car.
I gotcha. And then how do you know, each patient's different, how do you know what to pack?
We just look over their orders and see what they need, what we need to do that day, and then we come back here and have all the stuff that we need.
All right, well, you go to work. I'll just ask questions while you're doing this.
All right.
You have a lot of stuff here. Take care of the entire Hampton Roads area.
Yeah.
I like that. So what happens if you run out of something? I notice you're saline solutions and there's none. What do you do?
Yeah, so we have a person that that handles this for us. Her name is Doreen, and she orders all of our supplies, and so sometimes she has them hidden somewhere, and we just go ask her.
I gotcha.
She knows where the backup is.
I notice you're low on Doritos and Snickers over here. So
we are. We're fresh out of those.
I'll
I
call
ate
somebody.
them this morning. Yes, call them please. We need. We have some trach care to do today, so we're going to grab a trach collar. We're going to grab some safety glasses, a cleaning kit, and a suctioning kit. Okay.
I'm getting so trained right now. Anything else we need? I'm doing absolutely nothing standing here as usual.
I believe that we might need a little bit of split gauze here as well. Mm-hmm. And like I said, this is for a trach care patient, which I think Kathryn is showing you today as well. So she'll be over in the other room to help you with
What about gloves?
We have some gloves here.
Okay, winter or rubber? Oh, they're rubber. Yeah. Okay, let's go.
Okay.
Well, my training as a home healthcare nurse continues, and Kathryn is here. Hi, Kathryn.
Hi.
How long have you been at Riverside?
Almost 20 years.
Wow, almost 20 years. You must love it.
Yes,
All right,
I do.
so we are going to, we actually have an official dummy here.
We like to call her Annie.
Oh, okay, hi. Annie is here, and you're going to train me a quick training on a trach clean out, is what we said?
Yeah, non-disposable intercannula clean.
And
then
I
site
forgot
care.
about that. Is the intercannula. Okay, so what do we do first of all, you would come to her house.
We would explain the procedure and we'd set everything up. So if you were her caregiver, I would walk you through it and explain the procedure. The first thing we would do is we would wash our hands so we could use some Purell. Can I give you some?
Sure.
Okay.
Can you warm it up first? Too late. Okay.
And yeah.
Nice.
Ordinarily, we would have masks on because of the pandemic and everything, but for this, we're not wearing it.
Okay,
This-
Annie, I don't think she's gonna have a problem with it.
Yeah. So we're gonna both put on a pair of clean gloves.
Okay, I'm very good with these.
Yeah.
Do you blow into them first?
No,
Why?
we don't want to put our germs on them.
Okay. Oh,
Annie won't mind, but in the real world, we can't do that.
I'm Jeremy.
And everything that I set on this area will be sterile. So I'm gonna dump everything into our sterile
All right, we're
field.
dumping. Go.
We're dumping.
All right.
Yeah. So dump all that out. We
Now
got two
what?
basins. We're gonna set them to the side.
Mm-hmm.
And I can touch this basin, it has a little lip. We're gonna set that to the
Gotcha,
side.
perfect.
Now we have to set up the cleaning solution. We need a half strength peroxide.
Okay.
So we would
Wait.
tear this open, or do you want to tear it open?
Sure, I'd love to.
You
Peroxide.
can dump it in here.
All right. It's right here?
Yep, go ahead and dump the whole thing in.
All right, good, good.
Okay.
All right, you got
And
that?
then, yep, now we're gonna use the other tray. We're gonna put half of the saline in.
So what do we got here?
So this
Liquid
is the
number two.
saline. I'm gonna pour half of it in here,
Just
the
half,
big,
okay.
and then half of it in the little.
All right.
And then we're gonna toss it in our double bag.
It's like baking a cake. You know exactly how much to pour in there.
Yeah, and then also as a new nurse, or if you're new to us, you always have the policies you can go by, you can print them out, or we would come out and help, walk you through it. Sometimes I bring the policies out and lay it right next to the patient while I'm doing things if I'm not sure, so.
Okay.
Yeah. Okay, so now we're gonna take the non-disposable intercannula out.
Right.
And you're gonna twist and pull it out if you want.
All right,
You would
doctor.
twist and turn.
Twist and turn.
And
okay.
you're gonna drop it into there.
All right. Very
Now,
good.
this is, so we've been clean up until now. This is where we would take our gloves off.
All right.
And we would clean our hands again.
Oh, my.
And now we're gonna
Okay.
put sterile
All right.
on.
All right. Very good. All right.
And I brought extra sterile gloves because sometimes we accidentally break sterile technique. We could just stop, clean our hands, and put on more sterile gloves. There's actually a way to put on sterile gloves too that you don't contaminate them. Okay, so the outside.
What she said was, so far I've done everything wrong.
So we're gonna pick it up by the cuff.
Oh, I see that. Yep.
Put it on, not to touch the outside of the glove.
Okay.
So like this.
Is this the left side or is this the right glove?
It should be ambidextrous.
Okay.
Yeah. And if you mess it up, no big deal, we got extra.
Could you repeat that word, please? Emma, what?
So you wouldn't want to touch the outside of the glove because that's sterile.
Right,
Like
but I just washed my hands twice. How bad can it be?
It's not sterile though. We have the non-disposable intercannula inside the half-strength peroxide, half-strength water. We would kind of make it turbulent a little bit. We're swishing it around. Then we're going to take our pipe cleaner,
Oh dear.
and we would, or our
Her nose
pipe
is
bit-
fine.
We'd go ahead and clean it
All right.
several times back and forth.
Okay.
You could dip it, do some more cleaning,
Fantastic.
throw this away,
Okay.
and then okay, I'll let you do the drying.
Okay.
So you're going to drop it in the saline one, and we're going
How
to do
far
some.
up? Just like
Yep,
okay.
and then we're
right.
going to kind of rinse it around.
Oh, I got you.
Uh-huh.
Okay. All right. Oh, how was the lasagna, Annie? Okay.
Okay, and then go ahead and pick it up, and we're going to
Pick it
clean
up?
it out with some
Okay.
Q-tips
I
or
love
the
it.
pipettes.
All right.
the other
Gotcha.
side.
Okay, we're
Uh-huh.
drying. We're drying. Okay, we're dry.
And then go ahead and take one of the 4x4s. You clean the outside.
Oh, I got you.
Yeah. Then we'll put it back into her neck. We'll insert and click.
All right.
So after that, we would assess the site, but we would maintain her airway, and we'd take away the 4x4.
Gotcha. So she's all set then.
Okay, and then you'll take the split 4x4 and put it around the tracheostomy tube site.
Called a split 4x4 because of the split 4x4. All right, we'll just wrap this right around there, correct?
Yes,
All right. How's that look?
looks great.
Well, Andy, thank you. You were great. Kathryn, you were even greater.
Thank you, so were you.
Thank you very much. All right, when we come back, we'll take a look at hospice care here at Riverside.